Good morning from WKYT News. I'm Bill Bryant, and we hope you're enjoying your weekend. Welcome to Kentucky Newsmakers. Later, the University of Kentucky is about to come to life for a new school year. The Chandler Medical Center is celebrating a top honor, and UK's top spokesman will join us in just a little bit. But first, millions of people go to work in the Commonwealth every day, and the safety and rules of that workplace are regulated by the Kentucky Labor Cabinet. How workers are treated and paid and how their safety is ensured on the job is the responsibility of the cabinet. The Bevin administration is also committed to taking a look at rules that apply to employers and businesses to see if some things can be scaled back, maybe to lure some more businesses in. Dealing with that delicate balance is Kentucky's Labor Secretary Derrick Ramsey. Secretary Ramsey was named to the job by Governor Matt Bevin in December. The secretary, well known to Kentuckians as an All-American football player, nationally recognized athletic director, and his previous public service in the Commonwealth as well. Mr. Secretary, welcome. It's good to have you with us.
Thank you very much.
Appreciate it very much.
Me, Bill.
You told me you're just really enjoying this job.
I'm loving it. One, I'm happy to be back home. I'm happy to support people that have supported me for a number of years. And so it's my opportunity to give back and support them. There's 1.9 million people that go to work every day, and our job is to ensure that they, just as they went in healthily, we want them walking out the same way. So that's a big part of it.
So they really depend on your cabinet to enforce the rules. And what is your goal in that regard?
Well, you know, we enforce the rule, but what we're going to take more of a lighter approach on this thing. We want to educate people because, as you mentioned, we're also compliance as well. And so rather than fining people, we're going to educate them to ensure that our folk know what to do day to day so that they can come back home healthy.
Is it often the responsibility of the employees as well as the employers to say, this is an issue we really need to take a look at?
Absolutely, and that's where a lot of unions come into play. They're the folk that ensure that they're safe. But ultimately, at the end of the day, it's our job to ensure that they're safe. And where they aren't safe, then that's where compliance comes in.
And so that's when you get a call, and your cabinet responds. And,
Absolutely.
And how do you do that? How do you go try to work out an issue when there is something going on between management and labor?
Well, we have a group of inspectors, and their responsibility is to go to the businesses on a regular basis to find out what's going on. There are inspections that are done. And then after that, in some cases where we miss some things or someone happens to get injured, unfortunately, they'll then contact our office, and then we'll send our investigators out to see what's going on. Has
your cabinet been affected by some of the new rules that have come down from Washington regarding, who is management, who is to be paid in what way?
Well, that's OSHA, and those are the guys that determine a lot of what we do, and certainly they partially fund us. But at the end of the day, a lot of regulations are set forth out on a national stage, and then we just have to comply.
Is your finding early on that most Kentucky workplaces are safe and that most companies want to have healthy workers?
Absolutely. They want to have healthy workers. The national average, and I think I'm right, I think it's about 4.8 per thousand. And our number is right about there, and actually it's below there. And so, but we're still trying to get better. We're not going to be satisfied until we're at 100% where every worker that goes in comes out that way.
We have many Kentuckians whose skill set does not match the jobs that are available. They have made choices in their educations or in their training that has not gotten them to the point that they're able to fill a lot of jobs that are available out there at this point. You're working on an apprenticeship program that you say is designed to address that.
I think it's designed for the state of Kentucky, actually. As you look at where we are educational-wise, for example, 60% of our young people go into college each year. They graduate from high school. Only 20 of that 60% goes on to graduate, so there are a lot of opportunities. There's another group out there between the age of 18 and 64, to be exact, over 350,000 of them. And these people do not have a GED, nor do they have a high school diploma. Now, to be eligible for the apprenticeship, all you need is a GED. So again, there's a lot of opportunities for folk to get back in the workplace. And one of the things we're talking about, Bill, we do not want people to have jobs. We want them to have careers. There's a big difference there. That allows them not only to take care of themselves, but allows them to take care of a family as well.
what would an apprenticeship be like?
It's normally, it depends. There are a number of apprenticeships. We have welding, we have electrician, we have HVAC, we have plumbing, on and on and on. And so some of these would take as few of, all of them take about 144 to 164 hours of class credit per year. And then some could take as many as on the job training between 4,000 to 8,000 hours. So it's a compilation of classroom and OJT.
What is the incentive to, obviously, you know, it's obvious you get the experience and the certification if you're the student or the person doing the apprenticeship. What's the incentive to maybe the company that's offering that opportunity?
I think the best incentive, or certainly if I were the employer, one of the best incentives would be that you get to grow your own. You take someone, you raise them, you train them how you want it to be done at your job, because let's face it, each job is different. Each company is different. And so if you get to train that person, they get to understand the way that you do things. I think not only will you have a great product there, but also when you grow people, when you invest in people, now they become part of the team. And I think also that lends to keeping people there on that job for many years.
So you would think there's a great chance that if somebody does an apprenticeship with a particular company, they might very well stay with that company.
I would think so. And let me give you a few numbers to talk about that. There's over 1,100 businesses right now in the state of Kentucky that have invested in apprenticeship. We have over 3,000 people that have actually gone through the program that are actually practicing apprentices in the state. When you start talking about jobs not only are in the state of Kentucky where there's a lack of skilled workers, that's a problem that we're facing nationwide. Now, with this apprenticeship, once you become a certified apprentice, you can go and work not only in the state of Kentucky, but the other 49 states as well.
And you make the point, they're good paying jobs in many cases.
Absolutely. For example, and this is, we had this one young man that graduated 2 years ago from Franklin County High School. He's a welder. Well, last year this young man made $148,000. After hearing about that, I consider picking up my torch.
Right. Well, understandably. And so, as young folks are making very difficult decisions, how much they're going to invest in their educations. They're doing, at this point, they're having to make a cost-benefit analysis, even whether college is for them or a two-year program or so forth. You would say consider the whole realm of possibilities?
Absolutely. And let me, you know, we have a plethora of examples here. Let me talk about this one young man that was at Marathon Oil. This young guy was not interested in school and somehow or another stumbled over apprenticeship. He became involved in that. Well, all of a sudden, he now becomes interested in school, becomes a better student. He then graduates, goes on to Ashland Community College, gets an associate degree. While there, he also gets his certificate for apprenticeship. Well, he then goes to Purdue University, got a degree in electrical engineering. That young person is working now at Marathon Oil. So understand when we talk about apprenticeship, we're not talking about taking people from academia or higher ed. That's not what we're saying. What we're stating is that this is another alternative, another opportunity for you to take care of your families.
If people want to find out about the apprenticeships, there is a website, KentuckyApprenticeship.com.
That's right.
Find out more info there.
That's right. That's right.
So many employers tell us, Mr. Secretary, they're having a difficult time getting potential applicants whose not only the skills match the jobs, but who can pass required drug screenings.
Right.
A real problem in Kentucky, and you're hearing a lot about that.
Absolutely. You hear it, and sadly, you know, daily we hear it in different meetings. And but it's a really, really, really bad problem, and I can't say really enough in this state. And it's something that we're concerned about, not only for workers trying to get a job, but those that have a job maintain a job because of the issue. This scourge is way beyond epidemic proportion. 220 counties around the country, the worst 220 counties. 54 of those counties are here in the state of Kentucky. So it's frightening, it's threatening, and it's something that this administration under Governor Bevan's leadership, we're working day and night trying to figure this thing out.
And that your cabinet has to take very seriously because you
Because
cannot
they're workers.
have, right, and you
That's right.
cannot have workers out there who are impaired.
That's right. You know, because one, you don't want to have us impaired, but second, the opportunity that presents itself for them to get injured or someone else to get injured with them.
Do you agree with the movement toward a second chance for some who have fallen? A felony expungement is going to be a process for many, and it's going to take some time. But is it something that employers and society needs to do to get people back on track?
From a personal thought, absolutely. I am 5,000% for this. I want to applaud the governor. I want to applaud the legislators that got behind that, House Bill 40, and got that thing passed. You know, once you've served your time, Bill, why should you be penalized for the rest of your life? You've done your time. And so these are able-bodied people that have served their time, and, you know, they made a mistake. And so we should not continue to punish them for life. And so hence this House Bill 40 allows them that second chance. And we're actually working with a number of the employers, talking to them about that. I'll be collaborating with one of my fellow colleagues, Secretary Tilley, with some programs regarding apprenticeship and people being released, and of course some people behind the walls as well. So it's an ongoing thing, but it's something that we're going to work like the Dickens to get resolved.
We're with Kentucky Labor Secretary Derrick Ramsey on WKYT's Kentucky Newsmakers. I want to ask him about the dual credit program, allowing some students to get high school and college credit, and a $100 million effort there for workforce development. That and more coming up, and we'll hear from UK's Jay Blanton about the new school year coming later on Kentucky Newsmakers. Welcome back. It's good to have you with us on WKYT for Kentucky Newsmakers as we visit this morning with the Kentucky Labor Cabinet Secretary, Derrick Ramsey. You also know him as a former All-American football player, one of those people who stands up and I'm looking way up. Mr. Secretary.
Those are very old people that remember me as a player, Bill.
We really appreciate you coming in. There is a deadline coming up on the Work Skills Initiative that you want to tell us about.
The deadline is August 12th, and what that is a pre-screening, and you can go on and apply, and what it will do is give you an idea as to whether you're on pace or not to make it, rather than wasting a whole bunch of time and then being denied. The idea to this is to get as many people, as many companies, as many organizations involved in this effort as possible.
Tell us about this dual credit program. It allows students to get a real jump start.
Yeah, now that I'm really excited about. I'm working with the Commissioner Stephen Pruitt on this initiative, and we're calling it Career Pathways. But what this initiative is, and again, kudos to the governor, he set aside $15 million for this effort. And what it is if you're a senior in high school, you could now take up to 6 credits, which are 2 classes, toward a degree while in college, all paid for by lottery monies. So it's just a way again of jump-starting our young people off into careers, because as you're well aware, college, and we talked about this earlier, is expensive. So here's an opportunity for you to have 2 classes or 6 credits when you go into your first year of college.
A little bit of a jump start there,
absolutely,
right?
Absolutely.
There is a $100 million effort for workforce development readiness, and that was introduced by the governor to the legislature, and they approved it.
Right.
Although there continue to be a lot of questions. What is this? And does it require that people collaborate and kind of envision a particular program?
You know, the interesting part about that, people are going to have comments anyway, so I think we're all accustomed to that. However, with this, what it does, and I think it's really cool, the reason I think so is because it touches 3 different veins here. One, secondary education, then post-secondary, and then a business. And so basically what you're doing is you're starting at the high school level, getting these folk interested, then taking them to the next level, and at the end of that, going to business. So you have all 3 tiers, if you would, to this. We think it's invaluable. We think it's an opportunity for the communities to be involved, as well as the businesses.
And this would be done in local areas?
Throughout the state.
So it requires the high school, the college, and businesses to be
That's
involved.
correct.
Yeah.
It's a three-prong where we get everybody involved.
Do you have one of those programs up yet, or is it just now?
No,
Yeah.
if you remember, they're applying for it right now.
Okay.
And the pre-application, again, you have to have that in by August 12th.
Oh, so
And
this
then
is all, you're talking
this is
about
all
this
new.
is all
This is
yeah,
all
yeah.
new, yes.
Yeah. All right. Well, we'll see how that all goes. How do you balance Governor Bevin's goal of scaling back regulations so that he can try to effectively lure businesses to Kentucky when he says that other states may not have the red tape that that Kentucky has,
Right.
but at the same time be very sure that you are making those businesses be compliant with federal laws and safety?
Right. Well, let me say again, my number one responsibility, again, Bill, is to ensure that all 1.9 million workers in the state of Kentucky are safe. That's number one for me. Now, second, when it comes to the regulations, what we're trying to do, the governor has a gigantic goal in making Kentucky the manufacturing state in North America. That's his goal. And so, having said that, we are inundated with regulations. And so these are, and of course we're going to be careful as to the ones that we're trying to eliminate, but we're trying to create an atmosphere where it's conducive for businesses to move here. Well, if there's a lot of tape to jump over, I may keep on going. And so we hadn't looked at these regulations in a long time. And so all of us secretaries have been challenged to go through our cabinets and see where there are opportunities to remove some of these regs so that we're more attractive to businesses coming to the state of Kentucky.
Are you hearing from businesses about what they would like to see removed?
Haven't heard what they would like to, but we've heard that you guys are overregulated, and so that hence make us not as attractive.
As you go forward in this job, what are your goals the next few months?
The next few months, we're going to push like the dickens with the apprenticeship, make people aware of it. We're going to thank the folk that have supported us over the years prior to my coming here. This is not a new initiative, Bill. You know, in the United States, apprentices have been around for the last 80 years. In Europe, they've been around for the past couple hundred years. And so we're just catching up to snuff. So we're just trying to, where opportunity permits, work with other cabinets to ensure that Kentucky is a great place that we all enjoy and live.
Secretary Ramsey, thanks for coming by. Appreciate it.
Thank
Let
you.
us know what's going on in your cabinet.
You got it. Many thanks.
Appreciate that. We'll be back in just a moment, and we'll hear from Jay Blanton from the University of Kentucky. It's a brand new school year, and UK Hospital gets a top honor. Back in a moment. Welcome back to WKYT's Kentucky Newsmakers. U.S. News and World Report has ranked the University of Kentucky Albert B. Chandler Medical Center as the #1 hospital in the state. It's nationally ranked for its geriatric care and was singled out for its cancer program. UK is also getting ready for a new academic year. Students starting to arrive on campus, always exciting. There are also some ongoing construction projects. We'll get an update on that. Later this year, the Singletary Center for the Arts is planning to host a U.S. Senate debate between Republican Senator Rand Paul and Democratic nominee Lexington Mayor Jim Gray. Jay Blanton is the longtime spokesman at UK, and he joins us today to give us some updates. It's good to see you. Thanks for coming in.
Great to be with you, Bill.
First of all, congratulations, and tell us about this top ranking for UK Hospital. It's also a very busy operation over there.
Yeah,
You know, how do you keep that balance of quality and everything moving through there?
Well, I think that's what that U.S. News ranking that you're referring to alludes to. Ranked #1 in the state by U.S. News, and they look at excellence really across a number of areas. We're high performing in 6 areas. The only cancer center in the state to be mentioned is high performing. And one of the metrics they look at, which I think speaks to your question about how you do that balance, is talking about not only patient outcomes and patient safety, but quality of staffing. And in February of 2016, our nurses receive magnet status. You could get into a big technical explanation for what that means, but what it simply means is they're simply the best of the best. And so it really is about quality staffing, and I was over in the hospital a couple times this week actually visiting someone and watching those nurses in that emergency room department, which is, to say the least, busy. Every day is a level 1 trauma center, and they really are the best of the best in terms of how they care for folks, the attention to detail that they have. So it really is an affirmation more than anything else, the quality of the staff and the sophistication of the care and the outcomes that are delivered there every day.
How do you keep staff motivated like that to do that kind of work 24/7 throughout the year?
Well, I think there's been a vision, I think, led by Dr. Carr for the last 15 years that very simply says that we want any Kentuckian, wherever they are in the state, to wake up every day to know that they don't have to leave the state to get the best care. We're a state with a lot of health challenges, and that really needs a nationally ranked and nationally regarded level 1 trauma center that provides the best in advanced subspecialty care. So that's the mission, and I think you've got a staff there of several thousand folks who are really committed to that mission, which I think also fits the mission of the institution as a land-grant institution that is so tied to our state, so tied to being what Dr. Capilouto calls the University for Kentucky. That hospital really symbolizes the best of that. So I think you've got everyone really aligned with the mission.
Research is very important at the university, and particularly in the health fields, and there is a lot of that going on. You made reference to Kentucky having these challenges. We know that's true. Do we try to tailor the research done to the challenges that Kentucky faces? Do we do that well in Kentucky?
I think so, and I would mention two things. Under President Capilouto, we really pushed forward, and with the leadership of the legislature, and particularly President Stivers, last year got permission to start work on a $265 million research building. The state's paying for half, the university's paying for half. That is really going to be targeted at health disparities, and particularly health disparities in Appalachia. So we are really tailoring our research toward those finding solutions for Kentucky. And the truth of the matter is, we've got some challenges, but when we solve Kentucky problems, we're solving global problems. The other thing I would mention specifically about the hospital, you mentioned geriatrics as being a nationally ranked program. Well, in the last 10 years, the number of patients we've seen at that hospital over the age of 75 has more than doubled. So we've got to have nationally ranked programs in aging. So we've got a nationally ranked geriatrics program. We've got a Sanders Brown Center for Aging that really concentrates on disease like Alzheimer's and dementia, and that has been continuously funded by the federal government longer than any aging center in the country. And we're going to have some exciting news about that in several weeks, I hope. So yes, we do. We tailor our research and the solutions we're striving for to meet the needs of the state very specifically.
As UK attempts to have that statewide mission, even with its health care, you keep moving out into clinics and other operations that are out in other parts of the state as well, right?
Well, I think one of the things that has helped fuel pretty tremendous growth at that hospital, patient discharges almost doubling in a period of about 15 years from 19,000 to almost 40,000. A lot of that has been fueled by partnerships and affiliations that we've established throughout the state, but particularly in eastern Kentucky. And the idea is based on how can we help patients stay closer to home longer. So if they're seeing their primary care physician and we're helping them with protocols and procedures, they can stay closer to home longer, and they only come to UK for the care they need, for the really sophisticated care that you can't get anywhere else, and then we strive to get them back home as soon as possible. It's those kind of partnerships that have, I think, fueled the growth, but have also helped us improve care throughout the state.
Well, the campus is coming to life. Students are rolling in for a new year. Will there be any changes that students and parents and those who are familiar or have connection to the campus will be noticing?
Well, as we've talked about before, we've been doing a little building on our campus.
Right.
The last 5 years, there's been $2.1 billion of construction that's either been started or completed. This fall, when students start, they're going to start moving in on August 13th. Classes will start August 24th. But we're going to open another 1,141 beds and 2 new residence halls on our north end of campus, that corner of Limestone and Avenue of Champions, or Euclid. Will, in fact, next week on August 9th, we're going to do a community open house for the new Boyd Hall and the new Holmes Hall, and that'll be sort of 1,141 high-tech beds. And then later in September, we're going to open up a $12 million restoration of the old Patterson Hall, which was that first residence hall built in 1903, and that's going to be a huge student support center. And then we'll be renaming some of the other residence halls over there for what Dr. Capilouto calls the first ladies of our campus, those halls over there that recognize some of those founding mothers of our campus. And then later in the fall, we'll be dedicating the new Gatton business building, that $65 million renovation expansion. And also in September, we'll be dedicating a $112 million science building.
All right, so a lot of building,
yes,
no doubt about that. And as those contracts are let, there are a lot of people who want an opportunity to be part of that. And a member of the Board of Trustees apparently was a bidder on several projects, got a $542,000 contract at Good Samaritan Hospital. Are the rules clear for board members about conflicts of interest or potential conflicts?
I would argue they're not only clear, they're exceptionally clear. Let's look at what state law, in fact, state law requires board members, if they're going to bid on business and be a part of business with the university, have to clear more hurdles, as they should, than the general public. Let's look at what they would have to do. They've got to notify every board member that they're bidding on a piece of business. They have to take out an ad in the paper, and they have to be the low bidder. So someone that generally bids on business with the university doesn't necessarily have to be the low bidder. The university has some discretion. We can look at 3 or 4 bids, and with some discretion, look at a number of factors. So a board member has to be the low bidder. So Mr. Berry, Trustee Berry, who you're referring to, his bid has one of the largest construction companies in the state, built the Humana building in Louisville, built 21C over here in Lexington, bid on 4 projects, got 1 of them. He was the low bidder. All right. So it's exceedingly clear what he has to do.
Football season approaches, you're ready to go, huh?
Oh, yeah.
All right. Okay. Jay Blanton, thank you. Appreciate you coming by for a quick interview. Thank you for joining us on WKYT's Kentucky Newsmakers. Have a good week ahead.